The lymphatic system consists of the lymphatic vessels, as well as lymphoid tissues and lymphoid organs. There are three functions for the lymphatic system. The first function is to maintain interstitial fluid volume. The interstitial fluid is the fluid that surrounds the cells. It is also known as the tissue fluid. This function is related to bulk flow. Recall that bulk flow occurs at the blood capillaries. At the arterial end of the blood capillary, filtration takes place. About 20 liters of plasma are filtered every 24 hours. When this plasma moves into the interstitial space, it is called interstitial fluid. 90% of it is returned back to the blood at the venial end of the blood capillary. The remaining 10% enters the lymphatic vessels and is transported back to the blood to become plasma once again. In this way, the lymphatic vessels are involved in maintaining interstitial fluid volume. The second function is to defend your body against pathogens or abnormal cells. Lymph travels through lymph nodes. The lymph nodes are the primary site where lymphocytes encounter their antigens for the first time. An encounter leads to an immune response. The third function is the absorption of dietary fats. Lacteals are specialized lymphatic capillaries located within the wall of the small intestine. When lipids are absorbed across the wall of the small intestine, they enter into the lacteals. The lipids then are carried to the veins where they enter into the blood. What is lymph? Lymph is interstitial fluid that has entered the lymphatic vessel. Edema is the accumulation of interstitial fluid or tissue fluid. If it involves a lymphatic vessel or a lymph node, it is called lymphedema. This occurs when lymph nodes or lymphatic vessels have been obstructed or removed, preventing that 10% from being returned back to the blood. This is a photograph of a patient who has undergone surgery for breast cancer. Several of her lymph nodes and lymphatic vessels have been removed. You can see the lymphedema in the right upper appendage.